Systemic treatment of metastatic renal cell carcinoma has drastically improved over the past 2 decades. Currently with the immune checkpoint inhibitors being an integral part of the first-line treatment for metastatic RCC, and the dual checkpoint inhibitors such as ipilimumab, nivolumab, or different FDA-approved combinations of immune checkpoint inhibitors and TKIs are very effective treatments, and they are widely used in the first-line setting for this disease. So even though the historical data has shown the survival improvement in the use with upfront cytoreductive nephrectomy followed by systemic treatment, the majority of this data comes from the time that we have used interferon as the treatment, as a systemic treatment for RCC. And the role and benefit of upfront cytoreductive nephrectomy is unclear with the use of more active regimens and combinations as using the immune checkpoint inhibitors and TKIs, as I mentioned. In this retrospective study, we have included 209 patients with metastatic RCC who received immune checkpoint inhibitors in either first or second line of their treatment and systemic treatment, and as either as single agent or in combination with other agents. And so the patients were treated in 5 collaborating academic centers in the United States, and the data was collected with the review of the electronic medical records and imaging reports. In general, about 84% of these patients had clear cell renal cell carcinoma, with 14 and 12% of them having some sarcomatoid and rhabdoid features present in the tumor. And the most common sites of metastatic disease were lung, followed by bone, adrenal gland, and retroperitoneal lymph nodes, as expected and similar to previous reports. And about 17% of these patients had liver metastasis. Looking at the history of nephrectomy, 55% of the patients had a radical or partial nephrectomy for localized disease before they developed metastatic disease. 12% of them had de novo metastatic RCC and had upfront cytoreductive nephrectomy before starting their systemic treatment. 27%, which are 57 patients, didn't have nephrectomy before starting systemic treatment. And in total, about 77 patients, which is 37% of our cohort, had a measurable renal mass while receiving systemic treatment. The overall response and disease control rates were comparable to previous reports, and we noted a decent response in the intact primary renal mass to systemic treatment in the range of about 70% response to immune checkpoint inhibitors and 62% response to TKIs in these patients. And 9 patients had cytoreductive nephrectomy after having a response to their systemic treatment. Although the overall response rate to immune checkpoint inhibitors was numerically higher in patients with intact primary renal mass in the first-line setting, there was no statistically significant difference in response to immune checkpoint inhibitors in the first or second-line setting in patients with an intact primary renal mass compared to those without. And similarly, there was no statistically significant difference in overall response rate to TKIs in the first or second-line setting comparing patients with or without an intact primary renal mass. PROBE trial, which is a prospective randomized study led by Dr. Vaishampayan, which just opened through SWOG, is aimed to investigate the role of cytoreductive nephrectomy in patients with metastatic RCC treated with immune checkpoint inhibitor combinations.